29th October is World Stroke Day. It's about raising the awareness about stroke. Stroke andre gotta henga stroke baratte, what are the symptoms of stroke, how can we recognize them, what is the golden hour period, life after stroke, life before stroke, all that shall be discussed. You hear it straight from the experts, from the doctors of Sakra World Hospital. You may have heard both the voices on radio, but here is the face today. That is Dr. Arjun Srivatsa from Sakra World Hospital. He is the director for Brain and Spine, Sakra World Hospital. I'm RJ Prithvi from Red FM. 29th October is World Stroke Day. Dr. Arjun Srivatsa, for those who have tuned in and also watching this, what is a stroke?
Brain attack. That's a simple word, is stroke, brain attack. Like you have a heart attack, it's brain attack. Of course, there are many, again, divisions in stroke, which you have when you're bleeding in the brain or the blood stops in the brain. But under one common heading, stroke, where some part of the brain is not working because of an issue in the blood vessel of that supply to the brain. That is stroke, basically.
Super. What does World Stroke Day mean to you or Sakra World Hospital or the community?
Stroke is a dangerous thing, but we have a shield, awareness. And that awareness is what we're talking about. That is what Stroke Day is all about, to spread awareness among the community on how we can understand our early signs, pick up a stroke, and what do we do next after the stroke. And that's where Sakra Hospital comes in, both awareness and in treatment.
What is your message for those who are watching this about World Stroke Day?
Understand what stroke is.
Which you already have.
Never ignore symptoms that you think are because of old age or because you've got memory issues. They're subtle signs, don't miss them. Little bit of a slip in the bathroom could be a stroke. People think that they fell and had a stroke and he became paralyzed. No, he got paralyzed and fell down. Okay. Small things like this, no? Forgetfulness, it's new, could be a stroke. Speech issues. Don't think it's because of age always, it could be a stroke. So these subtle signs, if you can, as a family, figure out early, you're going to prevent a huge disabling disease called stroke.
Dr. Arjun, what are the biggest barriers that people face in accessing stroke treatment?
The whole idea is from the point of stroke to the point where we can treat should be shortened. We are very good at handling heart attacks nowadays. We talk about from time of attack to ballooning or stenting is like 45 minutes. Now we are not there in stroke yet. We need to get to that level. So the barrier is, one is understanding the patient having a stroke, so recognizing in time. Second thing is to reach a hospital that's stroke ready. So that is the biggest issue in Bangalore because of the traffic and delay in reaching the hospitals. I'm glad that there are many hospitals opening up in Bangalore. People say competition, I think it's good for the community. That hospitals are opening up big, all of them are stroke ready, and that is going to go a long way in reducing the barriers that we are having right now in getting stroke patients to hospitals.
But Bengaluru traffic is not stroke ready.
That's true. They cause strokes.
Do about that?
They cause the strokes actually.
True. Is stress actually a factor for stroke?
Absolutely, absolutely. It's a contributor to a stroke. It's not a causative, but it's a contributor, a huge contributor.
Marriage?
Bigger contributor, stress.
This is a very important piece of information regarding stroke. October 29th is World Stroke Day. I have a specialist, an expert from Sakra World Hospital, Dr. Shailesh. He's a neurosurgeon and endovascular neurosurgeon. Quickly, for those who are watching this, what are the warning signs of a stroke?
So for general public, for them to remember it easily, I would like to introduce a mnemonic. It has already been there. So B fast, B-E-F-A-S-T. That B stands for balance issue. There is sudden loss of balance. E for eye. There is disturbance in your eyes. There will be transient loss of vision, which we refer to as eye. And F for facial drooping. A for arm weakness. S for speech disturbance. And the last T, time is the essence, time is the most important thing which we have to remember. Whenever these symptoms are there, reach a stroke ready hospital at the earliest so that you can limit disability, so that you can get the life-saving treatment which is necessary for stroke. So the last T is very important, time is the essence.
Dr. Shailesh, what are the misconceptions that people have about stroke?
So there are a lot of misconceptions about stroke. One of this in the rural side especially is that they say it is a curse from the god, or it is because of black magic, which is totally not because of that, which is very important that we all are aware of this.
Yeah.
And the second thing is that we all think that stroke happens only in the elderly people. But stroke in young is rampantly increasing, especially the urban population like Bangalore and the major cities in India. Every year, about 1.9 to 2 million people get affected by stroke. Their lives get affected permanently because of stroke. So these are the common misconceptions that we all have about strokes. We need to come out of it, get educated about stroke.
What are the lifestyle changes that people can incorporate to reduce the chances of a stroke?
So when we all speak of lifestyle effects are total health, mental health, physical health, how we live and how we take ourselves forward. Stroke is also one such thing which is totally preventable. By improving our health, giving a regular time for exercise, maintaining a healthy diet, low carbohydrate diet, low lipid diet. And
what is low lipid diet?
Low lipid diet is a diet where you don't take in saturated fats directly.
Like
oil to a certain limit is accepted. Things like butter, ghee, etc. and meat containing high amount of fats have to be avoided. So this is what I mean by low lipid diet. Apart from this, fruits, vegetables and fresh produce has higher rich amount of antioxidants which can prevent stroke occurring in future.
What do you do to maintain good health?
So the major thing that I do to prevent risk factors for stroke like hypertension, diabetes is maintaining a low carb and a healthy lifestyle, run every day, give a good amount of time for your regular exercises, and stress management is very important. Stress is the leading factor for diabetes, hypertension, hypercholesterolemia, things like anxiety, depression, which all increases the risk of stroke indirectly.
In my opinion, it's only an excuse when you say that I don't have time for exercise. That is just absolute exercise. I think everyone should take in few minutes every day to exercise, and
you need to give a dedicated amount of time every day so that it becomes a part of your routine, so that you can maintain a healthy lifestyle and a healthy mental and physical life.
I have a super specialized person with me. She is an expert with 100% results. Please say hello to Dr. Rupa Sheshadri. Thank you for your time, Dr. Rupa. Senior consultant specialized in advanced treatment of stroke and brain bleed caused by aneurysm. Arthaita? No. Please explain this, Rupa.
So, interventional neuroradiology is an advanced and latest field in the field of neurosciences. So, neurology is a field where doctors train for 3 years after medicine to understand the neurological diseases and treat them with medicines. Neurosurgery is a field where the doctors train for 3 years in opening the skull and doing direct surgery on the brain.
Okay.
So they open the skull and whatever is there, they do direct surgery on the brain. So interventional neuroradiology, it's also called as neurointervention. What we do in this is, we don't go anywhere near the head.
Okay.
So just like an interventional cardiologist does angioplasty and stenting for the heart.
Right.
So we go from the leg
Okay.
and or the hand blood pipes by making just 2 or 3 millimeter incisions.
And you go to the brain.
Yes, we go inside the blood pipe to the brain. And there, stroke is caused by blockade of blood pipe. So this blockade we remove. This leads to recirculation of blood to the brain.
Yeah.
And that saves the brain. And that saved brain reverses paralysis. Or it reduces the severity of paralysis because we are saving the brain from death.
How many years of training does one need to go through? You,
Yes.
for instance.
So, for example, after MBBS, when I saw this neuro intervention at NIMHANS, I decided to take it up. For this, I had to train for 6 years after MBBS. The first, I had to take up radiology. People get surprised. Yes, we do radiology.
But why radiology?
Because we do here imaging and interventions. We are exposed to radiology because doing this imaging, we do this surgical interventions. Radiology gives us visualization inside the body. So we put X-rays in cath lab, visualize that, and without opening the body, just with 2-3 millimeters in the leg, we go inside and we repair
reach
the
the
blood pipe. So when there is a blockade, we remove the blockade. And this is also a kind of stroke called ischemic stroke. So this reverses paralysis.
What are the questions that I need to ask as a patient to the doctor about your specialty?
So you
specialized
have to
hospital?
search for people who have done training in interventional neuroradiology or neuroradiology. Now this is given in big institutes like National Institute like NIMHANS or in PGI Chandigarh or AIMS or in big institutes where this DM course, which has 3-year course in neurointervention, is given. So any doctor who has done minimum of 3 years training in this minimally invasive neurointervention, it's like an interventional cardiologist. So we are doing minimally invasive surgical interventions in the brain. So just like an interventional cardiology, they train for 3 years. Similarly, we train for 3 years for doing minimal interventions on the brain.
What is your message on World Stroke Day? What is it that you want to convey to people who didn't know about any of this?
So I want to tell people that you might know a neurologist who does medical management, a neurosurgeon who does direct operations on the brain after removing the skull. You might not have heard of interventional neuroradiologist, also called as neurointerventionist, endovascular neurosurgeon, or an interventional neurologist. All this is one and the same. So what we do is, we do minimally invasive blood pipe repair in the brain by going from the leg or the hand. Just like an interventional cardiologist does for the heart, we do for the brain. But the pathologies or the diseases of the brain are a lot. It could be a blockade, which we remove and reverse paralysis or reduce paralysis, or it could be a leakage caused by an aneurysm called as leading to brain bleed, wherein we go and we block that aneurysm with coils. This is called as procedure of coiling or flow diverter placement. These are very, very complex procedures and they need to be done by people who are extremely well trained in this. Otherwise, it could be disaster. So search for people who are very well trained in this and go to them.
Fantastic, thank you. This was educative. I have the senior consultant and lead for stroke and stroke treatment from Sakra World Hospital. We have spoken a lot on air. Dr. Amit Kulkarni, welcome. 29th October being the World Stroke Day. Why is it so critical to identify the symptoms of stroke early?
Whenever there are stroke symptoms, it means that slowly and surely some part of the brain neurons, some part of the brain cells are dying if you don't correct or don't revascularize in time. So what do stroke symptoms mean? Any of these stroke symptoms which we have discussed about, which is balance, eyes, F for face, A for arm or leg, S for speech, and it is T. So if any of these symptoms are there, it means that some part of the brain is slowly and surely getting deprived of its important blood supply and oxygen, and it's slowly and surely dying. So unless you identify this as to where the problem is, what the problem is, and try to correct and try to take remedial action, it is going to be like this, that the brain cells will more and more permanently die. And more they permanently die, more and more is the difficulty to revascularize or more and more difficulty to reverse the stroke symptoms. Then it's only about damage control and it will be only about further rehabilitation and some basic treatment. So basic job here is to identify what kind of stroke it is, which means there are again two types of strokes. One is a blockage, which leads to decreased blood supply, decreased oxygen to the brain. If we find that, then it means that that artery has to be opened up by two means. One is either through the blood clot buster or through mechanically taking out the clot. Now if it is a bleeding in the brain, we have to ensure that that bleeding stops and we have to ensure we take corrective action so that this bleeding does not occur again. So hence, whenever somebody has these symptoms, the time is brain, which means every minute we lose critical 1.9 million neurons, which means as soon as you have these symptoms, no time should be lost, and as soon as the patient is wheeled into the emergency, we have to do a CT or an MRI to pick up what kind of stroke, and then subsequently we have to take a quick action.
How is Sakra Hospital equipped with managing stroke treatment?
Sakra is a stroke-ready hospital, which means anybody who comes to the ER, we have set protocols in place. What do these protocols mean is we try to minimize and cut this unnecessary time taken for any of these procedures to be done. So there are no unnecessary delays, which means as soon as a patient comes to the ER, we do a quick glucose testing, that is GRBS testing. We do take the patient immediately to the CT or the MRI, which we feel is deemed necessary. And on the way to the MRI or CT, we will do NIHSS assessment. This is a stroke severity assessment. We don't wait for it to happen. We do it on the way or en route while the patient is being wheeled to the CT or an MRI. So, as soon as the CT is done, we are ready with a thrombolytic injection, which we will give if the patient deserves it. That means patient is within the window period. And if the patient still has something like critical blockage where this medicine is not going to open up the artery, we have the system in place to have an intervention where the wire is passed all the way from the groin puncture into the neck and we take out or pull out the clot. So this is called as mechanical thrombectomy. So these are all things which we are equipped with. So we have something called as code stroke or code white, which means as soon as a patient comes to the ER, a code white is announced. That entire team members, which includes the ER team, which includes the radiologist, which includes the stroke neurologist, it includes the lab people, and as well as the interventional neuroradiologist. So all of these people are immediately informed, immediately a ring goes to them, and everybody is alert. So as soon as we find that there is a clot, there is an ischemic lesion in the brain, we are ready with thrombolysis, which we give an injection, which is given within 4.5 hours. And if somebody deserves further treatment, that means the artery is not opened up, then we are ready with mechanical thrombectomy. So we are a stroke-ready center where it's a well-oiled machinery, I would say, and we have the protocols in place, we have a code white in place, so we don't lose precious time.
Dr. Amit, what do you do to keep yourself fit?
So I am a regular runner.
Oh.
So I run at least 3 days in a week. I am supposed to also do some strength training.
Supposed to.
But I am sorry, I don't do that.
Okay.
But yes, running I do at least 3 days in a week. And that's also one of my passions.
I have two doctors with me. Thank you for joining. Dr. Chandrasekhar, Senior Consultant Neurosurgeon. I have Dr. Alok Upar, Consultant Neurosurgeon. We have spoken many times on air, but now also for the camera. Who are at a higher risk for stroke? Either Dr. Chandrasekhar or Alok, anybody can take this.
So, as far as stroke is concerned, anybody can be affected by stroke. So, it is like young people, children sometimes, and the old age.
Children?
So, the more commonly affected are elderly people, say 55 plus or 60 years.
Okay.
They are more prone to get strokes. Okay, the risk factors in these age groups are uncontrolled diabetes mellitus, hypertension, chain smokers,
Okay.
excessive use of alcohol, drug abuse, lack of physical activities, and any cardiac problems.
Okay.
So they can be at a higher risk when compared to other people.
How do you think one could reduce the risk of stroke?
Okay, so if you look at the risk factors for stroke, like Dr. Chandrasekhar has enumerated, there are modifiable and non-modifiable risks. When I talk about the modifiable risk factors, these are usually lifestyle related. You can always work on yourself to keep yourself more active, maintain a good diet in the sense, you can look at really simple basic things like keeping a check on the amount of salt that you consume, not consumption of too much of salted products,
Okay.
and usage of good amount of water per day, and unwanted fatty acids should be avoided, like saturated fatty acids.
Like butter?
Yeah, so the more and more of such fatty acids that you use, the chances that they go and accumulate and cause blockade of vessels is on the higher side. Now when this combines with elevated amount of sugars in the body, that becomes a dangerous combination, which it makes a very good base for it to form plaques in the blood vessels, which eventually keep growing over a period of time, and in one fine day the vessels get blocked because of these plaques, and then you have what is known as a stroke. Yeah, stroke basically is nothing but blockade of arteries resulting in death of some part of the brain tissue.
In your experience, Dr. Chandrasekhar and Alok, what age group of stroke patients have you personally experienced? Are they all around 40 plus, 50 plus, 60 plus?
Yeah.
What are the high age group risk category?
There's like 50 plus. We are seeing nowadays. We are seeing young people also. Because
Like what age
lifestyle
group?
changes. Say 30s and 40s.
You have seen in the recent
Yes,
past?
yes.
And when you talk to them, have you realized it's only because of the lifestyle
Yes.
issues?
And of course, comorbid condition like diabetes and hypertension,
Really?
smoking, obesity. I said what I said, like lack of physical activities.
Yeah.
So those things are supporting. I mean, the probably risk people.
And what is it that a patient needs to know post-stroke treatment recovery?
Post stroke, what happens is the patient has reached hospital. We have done the treatment, but the next challenging thing is how you take care of him. So patient himself, as he comes, he is not independent. He needs somebody to support his daily activities like brushing, dressing, washroom, or even
How many
bathing.
days is this?
So these all depend on how severe the patient is. They
Okay.
could be mild, they could be moderate, they could be severe. So most of the mild people, they can take care of themselves, but however the mild and moderate group and the severe group, they are totally dependent, they cannot be independent. So for every daily activities like what I said, they need somebody's support.
But
So-
generally, how many days does it take?
It can vary.
Recovery.
Suppose that's what it depends upon how early they have come to the treatment.
So, for the diagnosis of stroke, you have multidisciplinary methods.
Yes.
How do you ensure that?
So
in
this
Sakra
is a code what you say fast, like face, arm, and because any lay person can understand this and can watch also. So anybody can do. It's not need a professional person. Any public, any common person can identify these things. Once they identify, they should react immediately and ship the patient to the nearest hospital or a stroke center wherever it is possible.
Looking for investigative modalities like what you asked, it's a very simple investigation that we do for picking up patients who land up in a possibly a stroke kind of a picture. We usually perform a CT scan, which is done in about 1.5 to 2 minutes. And usually a CT scan picks up most of these strokes that have happened. We have radiological evidence that a stroke has happened in most CT scans that we perform on such patients.
Okay.
In some patients, CT scan may not be able to exactly delineate the quantity or the amount of stroke that has already happened or the salvageable tissue. In such patients, after initial stabilization, we subject them to an MRI. An MRI would be able to give us more information about the soft tissue. CT scan usually gives us gross idea about what stroke or the magnitude of the stroke. But an MRI will give us more finer details about where the stroke has started, where is it evolving, where we can prevent it further from progressing. Those information are usually picked up on MRIs. But MRIs we usually don't do unless we have a patient who is really stable and we can subject him to an MRI for about 30 to 40 minutes because MRIs...
That you will take a call once
Yeah,
you see the
so
patient.
MRIs usually take time. CT is a very rapid testing.
So a person who has suffered a stroke can completely recover and regain normalcy in life?
No, that's what I told as the golden hour. That is the most important case because stroke is an emergency, critical. So they should be shifted immediately so that they can, what is the golden hour, like clot busting medications. Give injection, we can see the wonders happening. Okay? So that happens, the earlier you come, the better the results.
That's Dr. Hemakrishna, consultant neurologist. Dr. Hemakrishna, why do you think young people are affected by stroke these days?
Hi, so basically the thought was stroke always happens in elderly people.
Yes.
Above 60 years of age was the general thinking. But these days we are increasingly seeing young patients with stroke also. In fact, last week we have seen a patient of 20-year-old who had a stroke.
Why do you think that's happening?
So, in one way our lifestyle is causing it because many people are obese these days. Obesity is the greatest risk factor. Some people will have a condition called obstructive sleep apnea because of the obesity. That also increases the risk of stroke. Also,
It's interlinked again.
yeah.
Right.
Also, diabetes and hypertension are starting early nowadays. So, our diet, our lifestyle, and the stress is the major factor. Because of stress also, people skip their meals and obesity risk also increases.
I think they should not get married.
I can't comment on it.
Yeah. Stress, yeah, sure, I think.
Physical inactivity is the most important thing, and people are not having time for themselves. They're always stuck in the office work or family course.
Bengaluru traffic.
Yeah, traffic is one of the important things. So the way forward is being physically active, following a healthy diet, and having a good routine, sleep and food routine, and some meditation. Self-care is very important. So these things are increasing the risk in stroke. Apart from that, there are certain conditions which per se increase stroke in young. One is a condition called atrial fibrillation,
What
which
is
is
that?
irregular heartbeat,
Okay.
which can throw up clots into the brain.
But where does it happen? Irregular?
Many people, there's no particular reason,
Sure.
some people will have it. And some young people develop stroke because of abnormal clotting tendency. So we call it coagulopathies. So that is also one of the important causes of stroke. And some people with heart defects, they can also throw up strokes. These are the common causes of young strokes. And as I said, OSA, we keep hearing I have snoring karke. So the most important reason for that is increased neck circumference, and there is collapse of the windpipe during
The
sleep.
increase in the neck circumference is also resultant of
Obesity. Some people will have generalized obesity. Some people will have only increased neck circumference, which will make the windpipe collapse when they are sleeping. So that can contribute to decreased oxygen supply to the brain.
So it's obvious that you have an active lifestyle to reduce obesity.
That is
Control
very
diet.
important. Active lifestyle and stress management. Good sleep. Sleep is most important thing because sleep is the phase where the toxic chemicals from our brain is cleared.
The complete rebooting happens when you sleep, right?
So if your sleep is disturbed, these toxic materials accumulate in brain. Not only stroke, they also result in memory problems and other things.
I've heard that Sakra is a stroke specialty center. You are very, very well equipped with
Yes.
handling stroke. Talk about the specialty here, please.
So generally when it comes to stroke, the treatment is if anyone lands up within first 4.5 hours, we do clot bursting injections. Okay. There is also a technique called mechanical thrombectomy, wherein if the clot is in the bigger blood vessels, we can physically remove it. This is for the first 24 hours. But if anyone comes after that, it is the regular blood thinner medications. That is for preventing further propagation of stroke. And after that, rehab comes into picture. So Sakra is well known for our rehab thing. So in rehab, we have different types of exercises which our physiotherapists or our PMR physicians will be prescribing as per the patient's disability. And apart from that, rehab requires an interdisciplinary team. That is, a speech therapist is required, an occupational therapist is required. For instance, if an IT person had developed stroke, so they have to go back to their occupation early.
Correct.
So there are certain things, some implants may be required, some specific treatments may be required. So it involves multiple specialists, speech therapist, occupational therapist, swallow therapist, and the regular physio. So all together will cause meaningful difference in patient's disability and help in faster recovery.
Super. Thank you so much for your time, Dr.
Thank you.
Thank you very much.
My only message for you on World Stroke Day is too lazy Akbedi, please exercise, keep moving. Movement is life. Move a little, walk a little, lift some weights. Wishing you an awesome year and great health this year.